Wild Bill, Rod Hill, and Dr. Lewis First, we're going to talk a little bit about coronavirus. Now, there are some people that are very afraid out there and are scrambling, and, we're hearing about, rolls and rolls of toilet paper flying out of places and people stocking up on canned goods. And, where should we be at this point?
Well, let's face it, Rod. This is a virus that is new. Nobody has ever seen it before. We don't know who's going to get it. We don't know how it's going to affect the people who are infected. So people get stressed. People get concerned. But the name of the game is to calm down and learn about this virus and then be part of the solution in terms of what we can do to protect not just ourselves. It's not about me. It's about us.
So this is about making sure that our medical system isn't overwhelmed with corona patients.
Correct. By saying, I feel good, this is there's a lot of safety here and a lot of reassurance I can provide. The vast majority of us will have mild to moderate symptoms. But
if we get it?
If we get it, okay, are going to have mild to moderate symptoms. But we don't know who that's going to be. And we do know that there are adults and children who may get very, very sick. And in countries like Italy, they are overwhelming the health system.
Right.
So if we let this spread, saying it's not going to affect me, it will affect us. And there will be patients, it could be a relative or a friend, who need our hospital, who need the University of Vermont Health Network, who need a hospital in upstate New York and can't get in because the beds are all filled with people having breathing problems from coronavirus.
So what you're saying is really we need to work on preventative maintenance here.
Right. It's all about prevention and reassuring. And if we can keep this virus out of the area as much as we can be part of the solution, even if we feel great, our being able to wash our hands properly, our being able to cough properly into our sleeves and not into our hands. Really, when I say wash hands, that's not a little bit of water and soap and we run back to work.
Did you hear about the Gloria Gaynor challenge this morning?
No.
This is great. You're going to love this.
Instead of saying happy birthday, at first I was afraid. I was petrified. Kept thinking I would never live without you by my side.
And by the way,
survive.
By the way, Gloria Gaynor looks great. She really does.
But it's not just about, we want to thrive here and not just survive. But I love that because that goes 20 seconds.
Yep.
And you really have to hit between the fingers. There are great videos on YouTube to watch how to do proper hand washing.
You know what? Maybe we should do that. We'll put up a WOKO video. Rod can wash his hands and we'll just watch. Meanwhile, I wanted to ask you a question on one of your other jobs, which is the dean of medicine.
Well, I'm not. I helped.
What are you?
I used to be the dean for education.
Oh, you got fired.
Not quite. I moved on to overseeing a national.
That was really rude. You talk about people hurting your feelings.
I teach my heart out there, Bill.
I know you do.
I teach my heart out. But there are wonderful educators there. There is Dr. Zala is the dean for education. But the bottom line is, as you heard from UVM yesterday, students who are not essential, nursing doctors to the direct care of patients who are learning, are still going to have classes, but they're going to be virtual classes.
Right.
Students who are on the floors, we need them. We need them healthy. We need to protect them, but they will continue to learn how to care for patients and be part of our
This is
clinical
probably
ward teams.
an excellent time for them to be learning in a hospital.
But interestingly enough, because of work, they will not be directly involved with any of the COVID-19 or the coronavirus patients.
Okay.
Because we need to keep them as healthy as possible and limit the care providers who are taking care of these patients. If we overwhelm this system, then I won't even have time to come onto the radio because we're all hands on deck. And if any of us get sick, it starts to really play a role in the workforce. Now, I'm staying nice and calm because we're not going to let that happen.
Right.
We're going to take the precautions and do the hand washing, cough properly, avoid crowded rooms where you don't know who's in that room with you, and do some social distancing. If you're in a room, try and stay 3 feet away from the people next to you. There are great ways. The glorifying elbow bump has replaced, I love a good hug, but wait till you see me elbow bump right now.
He was really good.
He was really good. I did it with him at the front door and I let him in.
You can feel the warmth. You can feel the love from my elbow bump.
A lot of this is prevention this morning is what we're talking about. Keeping your hands clean. Stuff that we should have been doing anyway, right?
That's correct. And if people were doing this, we probably would not be facing what we're facing. But the good news is we can do this. We can wash our hands. We can cough properly. And if we do that and think about it consciously, even when we're feeling great, we will handle this and keep this germ from spreading the way it's doing in countries elsewhere in the world.
Well, the other thing we haven't mentioned either is if you're not feeling well,
stay home.
Stay home. Don't go to work.
There's a culture in Well, certainly Rod and I have this culture where we come in
I have this culture
when
too.
we're sick.
Yeah.
When we're sick, we can at least get through the show. You know
we
what
say
I mean?
we'll muscle through that and then deal with it after.
And that's our culture here at the radio station. We leave afterwards, but if we can get the show in, then we're all set. That's not good. We got to stay home.
That's correct. We have to stay home. It's a short term. It's sort of, that's the hill so that we don't all miss work. Whether it's on the station, whether it's at the hospital. If we think we go in and we're doing something great to be a hero, you may be winning your personal battle, but we're losing the war. Mm-hmm. And so the name of the game is not be a hero. Better to do it while if you're having mild symptoms, call your doctor, call the Department of Health, run your symptoms by them, but do it from home.
By the way, Vermont 211 will get you in touch with the Vermont Department of Health in order to answer any questions that you have about the coronavirus.
Now, driver Dan called in. Didn't he have a question?
Yeah, he was talking about, we know a lot about people who are being infected and people who are dying. What's the recovery process like for coronavirus?
Well, first of all, people need to understand the vast majority of individuals who get this virus don't die.
Right.
Right? We just don't know what's going to happen. And obviously, adults and children with underlying illnesses or who are immunosuppressed, they're more at risk. And senior citizens, we understand, are more at risk because of their immune systems. But it can also affect a healthy adult. So once you have it, it behaves like a really bad cold or the flu. It's going to hang around there, averaging about 10 days to 2 weeks. You're going to perhaps have the cough. You may have the runny nose. You may be running the fevers. But estimate the fact that you're going to be out sort of for a little longer than a simple cold, but then you will start to feel better and you will have immunity to this virus, but we don't know how long the immunity lasts.
Okay.
And
we don't know if this virus is going to mutate at all.
We don't know. We do know as well that it lives with other viruses. So many of the children who have gotten this in other countries are also showing up with the flu, with respiratory syncytial virus or RSV. So even culturing for those and saying it's flu, it's not corona. Corona could be there.
I want to get this question, and it was a great question from one of our listeners.
I'm almost 80 years old, and I want to know if I should limit visits from my grandchildren.
What a great question.
It is a wonderful question, and it's an important question. First of all, you need to understand how healthy are your grandchildren.
It's just like coming into work. If your grandchildren are sick,
they shouldn't come see their
But
grandparents.
what about during the incubation period? Isn't there a certain amount of time that you have to worry about that?
That's why we're all washed. We will not know. And that's where everybody needs to stay calm and take the precautions. But families are important too. So if children are healthy, they probably will not want to hug each other, but a nice elbow bump between grandchild and grandparent is
that can be fun, by the way.
Yeah.
And then some social distancing. Again, sitting 3 feet away and having family time is going to be good. If there's any question that a child may have been exposed to another child at school, but you don't want to completely disrupt family structure, but you don't want to also bring hundreds of family members together into a room. So I'm really, really hoping that grandparents and grandchildren can spend time together. And if there's a cold, then use FaceTime and spend that quality time.
That's true. We have these technologies where you don't necessarily have to
it's
go.
the same technology that we're using for the UVM students and all the other students across the nation.
And if there's any question, call your healthcare provider, call the Department of Health in New York, the Departments of Health, or in Vermont. The websites are phenomenal. And the American Academy of Pediatrics has a great website for families.
Healthychildren.org.
That's correct. And there you can find out all you need with many of your questions being answered about family issues such as that call.
Hey, any final words you want to leave our listeners with? If someone, what about this? Somebody is feeling super nervous. They feel like the coronavirus is going to get them. What do you tell them?
Very simple. First of all, listen, educate, go to the Vermont Department of Health website, go to the Centers for Disease Control, go to your hospital's website, learn and be educated, then be reassured from a standpoint of focusing on safety and prevention. So again, you will be safe and we'll stay calm if we take the preventive measures, even if we're feeling healthy, to prevent this germ from spreading. And if we do that, we can do this, guys. We can do this. And you know what happens when we do this? We really are first with kids.
Oh, boy. Knew what that was going to be.
You brought it back.
I want to see.
We're trying to rebrand.
I
here.
gotcha.
We're trying to rebrand.
I want to see him as a superhero, fighting germs on the weekend warrior, Doctor First.
Hey, just one last question from me personally.
Oh, here it comes.
How many rolls of toilet paper should I have in my house?
Well, you don't want to wipe out the county.
I don't know why I expected
you
anything
really
else.
should have gone there. Oh, man.
Yeah, we'll end with the royal flush.
Oh, there we go.
Right, Dr. First, thank you very much for joining us this morning on the Morning Roundup.
That was so bad it hurt my feelings.